I have in this bag the best medication to treat the cold and flu. Maybe you or a loved one is feeling rough right now. Maybe they have a virus and their nose is runny and they just feel all over horrible. Well, what's the best thing that you can help to treat yourself or someone else? There is a lot of products out there and not all of them are really that effective. In fact, most of them are junk, so it can be a very difficult experience trying to select the right product. I'm Grant Harding. I'm a licensed pharmacist in 3 states and a drug pricing expert. And although what I'm about to tell you here today is the exact same way I would treat myself or a loved one, health-related information on YouTube does not apply to everyone and isn't medical advice. If you have a medical concern, make sure to get in touch with a healthcare provider. If you think you may have a medical emergency, get in touch with your doctor or local emergency number. That being said, I'm an expert in what I'm talking about here today, and I feel very, very confident in everything I'm about to educate you on. So the first thing we have to understand is what a virus is. Viruses are actually very, very different from bacterial infection, for example. Viruses have very sloppy metabolism, and they're very primitive, and by strict definition, they technically aren't living. And I know that's very difficult to understand, but the point here I'm trying to make is this actually isn't very easy. Even though for the most part a common cold isn't going to cause serious issues, the flu definitely can, and treating it is not an easy task. So a lot of people don't understand the difference between the flu and the common cold. And the reason for that is because the difference really isn't that important. So the flu is a disease caused by the influenza virus. The common cold is kind of a colloquial term that people use to describe a condition caused by quite a few different viruses, but most commonly rhinovirus. So what's the difference? It's really tough to say. I mean, their genetic code is going to be different, but the symptoms are very, very similar, and you really won't even know which one you have unless you do like extreme lab testing. So then, whenever you're feeling sick, do we really care about the difference? Not really. But before I teach you how to treat this condition, I want to tell you about the products to avoid, because there is a lot of them. Number one thing is you cannot use antibiotics. A lot of people get upset if they go see a doctor when they're feeling sick and they don't prescribe them anything. That's your best interest and society's best interest, by the way. If you take an antibiotic whenever you have a viral infection, not only are you not going to get better, you put our entire society at risk for developing resistance to those medications. Now, beyond that, there's quite a few over-the-counter medications that are absolute junk. Number 1 on my list is Dayquil and NyQuil. These are garbanzo beans. Absolutely nothingness. These have medications in them to help treat symptoms, but not the actual virus itself. If you look at the back of the bottle here, look at the package here, it contains things like acetaminophen, doxylamine, dextromethorphan, and those are all wonderful drugs in and of their own right, but you needing this very specific combination is very unlikely. And to make things even worse, this is really expensive. These are like $20 a bottle or something like that. I'll show you a better way to treat these symptoms later. Next on the list is Theraflu. And I know this is so confusing because it literally has the word flu in the name, but it's the same thing. Look at the back. All it has is it's literally just Tylenol and a couple other things that they cram into one liquid. Now, on the off chance you actually do have symptoms that match all of these, I mean, you're welcome to try it, but I'd still rather you don't even buy it, because more than likely, somewhere down the line, you're going to have 1 or 2 of these symptoms and need the individual product itself and not this weird combination. Another medication I tell people to never buy is guaifenesin. The brand name for this is Mucinex, and it is absolute junk. Studies have shown that it's not effective at all. It's supposed to help with cough, and it just doesn't. It's just junk. Another one is echinacea, or however you say that. I don't know, it doesn't do anything. But the granddaddy junkster, junkiest of them all, is this right here. I don't even know how to pronounce this. As a pharmacist, it is my duty to never know how to pronounce this. I call this Osocilium because it sounds like I'm saying it's oh so silly, and it is. This is complete and total junk. It does absolutely nothing, and what's very interesting about this is that quote-unquote active ingredient which is not active at all, is incredibly dilute. There's something in here that doesn't help, and there's not very much of it. To prove to everyone how junky this is, I'm actually going to take this year whenever I get sick. So that'll be an upcoming video later. Now that we've thoroughly discussed all the junk out there, so what are things that actually help? A lot of people like vitamin C, and what I can tell you about that is vitamin C supplementation actually does help reduce the length of sick days if it's taken, for a long period of time, like a daily vitamin C supplement, but it doesn't help reduce the risk of getting sick. And once you are sick, it's not going to help you get better any quicker if you start taking it when you're sick. So I'll leave that up to you if you want to try that. For me personally, I don't use vitamin C. Whenever dealing with the flu or a cold, one of the things that helps a lot is just treating the symptoms rather than the disease. But you can also treat the disease, as I'll talk about later. The most common symptom people have is fever and aches, and this is where liquid acetaminophen comes in. You can also use the tablets if you want, but a lot of people prefer the liquid when they're sick. It's kind of difficult to swallow sometimes, right, whenever you're feeling crummy. So this is what I recommend. This is acetaminophen from the Dollar Tree. Now, I recommend this because this is the cheapest liquid acetaminophen you will ever find. And I actually looked at a wholesale distributor for pharmacies, and they don't even have a price this cheap. For $1.25, you get 118 milliliters or 4 floral ounces, and you will never find a better price anywhere else. Dollar Tree acetaminophen is the best for treating fever and aches. A lot of people ask me about ibuprofen. Ibuprofen is fine as well. You can get 200 milligram tablets at the Dollar Tree. This was $1.25 for 30 tablets. I think this is a great deal. The ibuprofen is, in my opinion, a little bit better for pain related to inflammation. And if you're sick, that's not really inflammation, but it still definitely helps. It does reduce fever, and it does help with the aches as well. You can really use either product, but I typically recommend acetaminophen first. Now, if you have a runny nose, which definitely happens whenever people are feeling like they have a cold, the best thing to use for that is an antihistamine, such as diphenhydramine from the Dollar Tree. This was $1.25 for 36 tablets, and they also have a liquid version as well. Either one is perfectly fine as long as it's being dosed correctly. Diphenhydramine is a first-generation antihistamine, and it really works. If you ever taken it, like, your nose feels very, very dry when you take diphenhydramine. A lot of people want to know about the other antihistamines. I typically don't recommend those, not for something like a cold. I mean, you can if you want to, but in my personal and professional opinion, diphenhydramine being first generation and short acting appears to have more of a powerful punch, which is what you want in this situation. People be getting nauseous whenever they're sick. I like this. This is actually a Coca-Cola syrup, or a cola syrup rather. It's just a very concentrated, sugary liquid that you can get any sort of nausea relief at any pharmacy. I got this at Walgreens, but whichever one you want to use. And it just helps soothe and coat the stomach with a soothing, relaxing feeling. I also forgot to mention that diphenhydramine actually helps with nausea as well. It's mostly nausea due to vertigo, but I mean, I would expect some relief from that if I was feeling nauseous from an illness as well. The best thing for a cough when you're feeling sick, pure dextromethorphan. Dollar Tree is the only place I have ever seen pure dextromethorphan non-extended release. I have never seen this before in my life, so this is what I recommend. Get 15 soft gels for $1.25. That is a great deal. This is one of my favorite finds in Dollar Tree, actually. The thing with dextromethorphan is it's not really that effective, but it's better than nothing. So this is typically what I recommend. Now, I don't have any of this here right now with me, but for a sore throat, I always get a sore throat, and it bugs the heck out of me. There's two products I really like. There's a chloroseptic spray, or its generic equivalent, which is phenol. You want to get the highest percentage you can find. It would probably be around 1.4%. Whatever the pharmacy has in the highest percentage, that's what you want. They also make preparations, I think, with menthol in it. I love menthol as well. Get the highest percentage of menthol you can get. We also have lozenges with phenol, menthol, benzocaine. I'm a big fan of benzocaine. Get all three, honestly. If you can find something that has all three in it with the highest possible percentage, this will really help your sore throat. Because if you're like me, I mean, that just really makes you miserable. Now, if you have a clogged nose instead of a runny nose, the best thing really is Sudafed, but you have to ask the pharmacy for that. They track how much you buy, which really shouldn't be an issue. But keep in mind, Sudafed and its generic equivalent are different from Sudafed PE. Sudafed PE is phenylephrine. Phenylephrine is garbanzo beans. It's junk. Nobody likes it. Sudafed is pseudoephedrine. These are different chemicals. They're supposedly similar, but like I said, phenylephrine just does nothing. We as in the pharmacist community do not stand phenylephrine. Okay, so you're sick, you know what to avoid, and you know how to treat the symptoms. How the heck do you make yourself get better quicker? Well, it's right here. Believe it or not, zinc. Zinc has been shown to be effective in treating viruses. Now, before I get too far into this, there's also intranasal zinc, which I do not recommend, and neither do the sources I looked at to make this video. Apparently, intranasal zinc can cause irreversible lack of smelling, which I thought was crazy. Zinc actually stops the virus from entering human cells, and there have been studies performed that prove that this is true, or at least we can feel confident making this recommendation. The studies that have been performed aren't the best, but they are good enough to make this something that I would recommend to myself or somebody that I loved. Lots of other very reputable sources agree with this recommendation. Now, the thing with zinc is that you have to start it quickly. Within 48 hours, I saw one source that said within 72 hours. I'm going to say as quickly as possible. The exact nanosecond that you start to feel sick, you should just have this on hand and you need to start taking it. So taking zinc, if you take it properly, will reduce the amount of sick days you have by about 1 or 2 days, which doesn't sound like a lot, but that's pretty par on course for a lot of our prescription medications, which I'll talk about in a moment. You obviously do not need a prescription for zinc. I want to make this point very, very clear. It doesn't matter what type of zinc you get. There's zinc gluconate, and I don't even know what the other types are. It doesn't matter. As long as there's zinc in it, that is the important part. Because our studies aren't really the best, we don't really know what the dosing is, and I've seen anything from 10 to 24 milligram every 1 to 4 hours for 3 to 7 days. Which, yes, means you will be taking this very, very frequently, and that's kind of annoying, but that's just the way it is. So I was only able to find 30 milligram tablets whenever I was buying this. I would just split these in half and take it probably every 2 hours while awake. There are also lots of zinc-containing products, which are great, but they're very, very expensive. And you can tell here some of the ones I'm showing, they have lots of other junk in there, things that you don't need. Now, our prescription medication for the flu and potentially the common cold, although its indication is for the flu, is called Tamiflu, and there's a couple other similar medications, and they only reduce the sick days by about 1 to 2 days, which is very similar to zinc. Now, the data we have for Tamiflu is much better, but it actually doesn't keep people out of the hospital any less. It doesn't stop really severe complications of the flu, it just reduces the sick days, which is still better than nothing. But the reason why I bring that up is if you don't have insurance or you don't have access to a physician, I would recommend zinc in those situations. Now, if you do have a prescription for Tamiflu or something similar, it's very cheap. If you use my discount card, you can go to crushcost.com and it's around $20, I think, for a 5-day course, I believe is what it is. Now, I will mention this. Most pharmacists hate Tamiflu because they put an expiration date on their product for 1 year, which means at the end of flu season, we send them all back to the distributor, and it's every year we have to buy it over again, and there's no reason for that. It's not like the flu shot where it's trying to predict the strains. The Tamiflu is the same thing every year. They just very sneakily put that short expiration date on the package. Same thing with Tamiflu or any prescription similar medication. You have to start it very, very quickly within 24 to 48 hours. Because of this, I've never used it. It's too difficult for me to start getting sick, make an appointment to see a doctor, and have a pharmacy fill it. And I don't believe, at least I've never asked, I don't think physicians would be too comfortable writing a prescription and just keeping it on file until you need it. I wish more physicians would do that, actually, but I've never been able to use that med, so I don't have any personal experience with Tamiflu. That's all I have to say about that. I want you to feel better. I want you to save money. Visit me at crushcost.com.